Alrighty, well, it is 9:05. Good morning, everyone, and thank you for joining us today for the 16th Annual Best Practice Conference. I'm going to go over some housekeeping items and the schedule for today to get us started. So for slide one, please make sure that you joined the meeting today using your full name. We cannot place you in the breakout rooms you selected during registration if you joined under a different name. If you need to change this, please click on participants at the bottom of your screen to open the participants window. Your name will be at the top of this list. Hover over your name, click on more, then select rename, enter your full name and hit save. These instructions can also be found in the housekeeping sheet in the attendee folder. We'll add the link to this folder in the chat now, which should be available to you if you look at your chat. So slide number two, just to let you know that this conference will be recorded. Everyone will be on listen-only mode. Please make sure your computer speakers are on and adjust the volume accordingly. If you do not have computer speakers, please use the phone in audio option. If you have any questions, please type them into the chat and make sure you select to everyone. If you have any tech assistance questions, you can direct those to Megan Buffington. Also, in order to receive a certificate of participation, you must attend the entire conference and complete the evaluation survey. We'll provide more information on the evaluation at the end of the day. So next, our morning session. This morning, we will be starting off with an overview of our current initiatives, followed by two keynote presentations from Dr. Amanda Fallon Bennett and Dr. Judson Brewer. For the lunch session, there will be updates from the Legal Resource Center for Public Health Policy and the Center for Tobacco Prevention and Control at the Maryland Department of Health. After this, we'll take some time to recognize organizations with exceptional referrals in the past year. Then moving to the afternoon, we will move on to the third and final keynote presentation by Natasha Phelps. After this, we will open up breakout rooms to begin our workshops. We will provide more information on this later on. Just keep in mind, in order to prepare for the workshops, we will be locking the meeting at 1 p.m., after which you will not be able to rejoin if you leave the conference. So please keep that in mind. And now it's my pleasure to introduce and turn things over to our Center Director, Dr. Carlo Di Clemente.
Well, welcome. I just want to say welcome to all of you, and a warm welcome, even though it's a cold day. We did avoid the snow again this year, but it doesn't really matter with the virtual. And I just want to kind of say we're grateful for all of you to come and spend the day with us. We have brought together some wonderful speakers, as well as very interesting workshops that I think you'll find. And so we're going to get started here and kind of move on. So first, what I'd like to do to kind of start off the conference is really give us an idea about where we're going. These are the Healthy People goals for 2030. And as you see, for adults, it's reduced tobacco use in adults to 16%. And then that's all tobacco use. That's not just smoking. And we've stalled a little there. So the pandemic probably is helping to do that. And so we need to kind of keep going. Reduce current cigarette smoking to 5%. We're still at 14. We still got a few years to go, but we need to kind of move on that. And increase the attempts to quit smoking, because we know that people have to make multiple attempts often to get free of the habit. And so we're trying to do that. We have about 56% making past year quit attempt. We want to get that up to 65%. For adolescents, we're reducing current tobacco use, and that has gone down. But it's not near in 2020. So in 10 years, we need to bring it down another 5-6% at least to meet our goals. The flavored products. Hopefully we're being helped by the FDA. We want to kind of bring that down, hopefully to zero if they ban the flavors, but we're still got a ways to go there as well. The good news, and this is maybe temporary because of the pandemic, recurrent e-cigarette use in adolescents is down to 7.6%. That's above our goal. But again, measuring this during the pandemic is is hard to do because the measures and the methods for getting this information is a little different. We used to go into the schools and that just didn't happen. So we'll need to kind of keep an eye on that and when we can get better data. With pregnant women, we're trying to increase abstinence from smoking to almost 96%. We're up to about 94. We still need to kind of do some work there. And then increase successful quit attempts in pregnant women who smoke to 24%. So that's, if you make an attempt, 24% of those folks, and that hasn't changed very much in 2018 and 2019. That's the latest data we have for that. So we have a ways to go, and I think it's really important for us to kind of keep our focus on the future as well as the present to kind of where we need to go and what we need to do. Again, as I did last year, I think we need a moment of silence to remember all those who have died from nicotine addiction and COVID. And I know we think about the COVID in any one year, it's about 450 or so thousand deaths. Tobacco related each year is 480,000 and almost 50% of those from behavioral health populations. So I'll just take a moment and do that. So that affects, when we talk about 480,000 deaths, we talk about families, and that affects double, triple, quadruple the number of people who've died of these deaths. So we need to kind of think again about the larger impact of the work that we're doing, trying to prevent death and disability. And we also need to kind of focus on ourselves because of the COVID, because of all the things that are happening, how to manage pandemic anxiety, burnout, and conflict. And that's the reason we brought in Dr. Judson Brewer to talk with us and to kind of work with us at the later this morning as we kind of go through this. So let you know about that. So again, the theme we have is really kind of focusing on vulnerable populations. And I think that's a really important thing to do. We have multiple subgroups in the population who are targeted by the tobacco industry, who have higher prevalence, who have increased exposure and mortality. And so throughout the day, we're going to highlight issues and initiatives for some of these groups of tobacco users. So Dr. Amanda Fallon Bennett will talk about the LGBTQ population and how to tailor to that group. We have concerns about African-American smoking and menthol, and Dr. Natasha Phelps will talk about that later on this afternoon in her keynote address. We have populations with mental health and substance use disorders, and I'll talk a little more about that, but we need to kind of focus on that, and we have a workshop this afternoon, a couple of them talking about and dealing with this. And then we have concerns about youth and young adults and their uptake of nicotine through vaping and other kinds of things. And we have a really interesting panel of youth from the Tobacco Free Kids, youth ambassadors, and they'll be part of the workshop this afternoon. So we have a lot of things trying to address these vulnerable populations. And let me just kind of highlight here the behavioral health tobacco use data. So if you look about prevalence of past year cigarette smoking, so that's any smoking in the past year with specific psychiatric disorders. If you have no diagnosis, it's about 17%. is higher for every one of the other diagnoses, post-traumatic stress, and especially when you get to alcohol use disorder and drug use disorder, it's really high, and especially high in bipolar as well. So that's the use of cigarettes. So you see that there's more exposure and there's less success. And this is smoking cessation among ever smokers with specific psychiatric disorders. When you think about lifetime smoking cessation, it's about 52% of people with no diagnosis. It's 13% if you have a drug use disorder, 19 for bipolar, and 21 with alcohol use. And again, you're looking at these, but many of the individuals that we know who smoke have multiple conditions that they're struggling with. So we really do need to kind of address this issue. Okay, so that's kind of background, and that sets the stage for today's conference. I'd like to just kind of share with you a little bit what we have in some of our current projects and programs, and let you know what we're doing, but also let you know how you can also kind of join in terms of what we're doing with at the Maryland Tobacco Control Resource Center. We have a website, and I would encourage you to look at that. We've done a lot of work on that. We update it. We put items of interest and spotlight. So even if you just check it once a week, you would see kind of things that are happening and some of the webinars that are around or being offered. We continually try to update our existing informational pages with the latest research and resources. We focus on special populations, but we also focus on different providers, different professionals who are doing this. We just recently updated the special population pages. So again, this is a resource that we hope you will turn to and use to support your efforts to help individuals quit smoking and quit using tobacco. We also have online trainings. So there are some online trainings that you can access. We did an ad in the Maryland Family Physician trying to kind of show that. And again, you'll have the access to these slides as well, so you can look at the information and kind of use it to kind of access the TCRC website. But we have, from the website, you can access our online trainings. We have a fax to assist training for people who don't have EHRs or access to kind of using the online referral through email. We have tobacco cessation training for Medicaid providers. And we have behavioral health, smoking cessation administration, and staff trainings. Those are all online. So you can access those whenever. We also have an initiative that goes back a good ways. We've had been working with Breaking the Habit in Behavioral Health, which we call BH2, for a number of years. I was looking back, and we go back to the efforts that the whole state was making at the time to try and reach behavioral health smokers. And this has been an ongoing process over the years. We are now doing virtual trainings through WebEx, and we have two sets of trainings. One is really training for what we call single session or brief interventions and individual interventions, or a single group session that you could run for tobacco cessation. And so we have a training in that. It used to be that we'd have the single session in the morning, and then people who were interested in groups could do multiple session in the afternoon. What we've done now is we have access to 3 different single sessions, and then on June 1st, we'll do a multiple session. We've conducted 7 trainings in 2021, 114 individuals were trained. We've had 5 single session and 2 multiple session trainings. So this is part of our ongoing efforts to train providers who work in behavioral health settings particularly, but all providers who work with individuals who use tobacco in kind of understanding tobacco habit, understanding the myths around behavioral health, and then learning some skills about how to address tobacco with their clients. And this is a follow-up survey that we do out of the 40 surveys that we've received. What you can see is many of these folks are from mental health facilities, substance abuse facilities, mental health and substance abuse. So almost 50% of the folks are there. But we also have people in LHDs, wellness programs, hospitals, private practices, and even schools attending these trainings. What do they do after the trainings? Well, we've tried to kind of get a handle on that and figure out, but some of them talk with administrators. Some of them actually train other people in their settings, which is great, and expands that information and training, because they all have the resources. So we have little manuals, we have information sheets, we have exercises that we hand out and people can use. The majority or the half of them are working with individual clients. There are some conducting group sessions in their settings. Many of them, a third, are using brief interventions, and some of them are working on smoke-free policies. This is something we need to kind of, we highlight in the training, but I think we really need the staff and administrators training to really help push the smoke-free policies in those agencies. So if you are interested in hosting a training and have providers that you would like, you can email us at trainings@marylandtcrc.org. We've already trained over 1,000 providers, staff, and administrators in the state of Maryland. We're working on our second 1,000 at present. So that's where we're going from here. Many of you have heard of, because we've talked about it in previous best practices conferences, the Stanford University Prevention Toolkit. And we've actually highlighted that in a conference several years ago. And many of our local health departments and some of our schools are using those. We have tried to kind of promote using the Stanford Prevention Toolkit. We've had a training in this past year for local health departments and tobacco control personnel. So this was specifically geared to the local health department folks who go out into the community to do prevention activities. We did that in February. We did a general overview of tobacco and the cannabis. They also have a cannabis toolkit if you're interested to go on their website. So again, all you do is Google Stanford Prevention Toolkit and you can get there. We had 30 local health department and other tobacco control people from 16 counties. And here's what they hope to do with the training: conduct small group sessions with youth, encourage community partners and schools to use the TPT in their work, and using TPT website in youth tobacco cessation and education classes. So that was, we had two trainings where we brought the folks from the Stanford in. This one was for the local health department folks. This one was really with school educators. So in collaboration with the Maryland State Department of Education, we reached out to school health educators and supervisors and had a virtual training at the end of February last year. And again, it was teaching vaping and cannabis prevention remotely using the toolkits. So we were trying to kind of help the educators do their remote teaching in that way. We had 25 school health educators. So these were health educators that actually were around from 16 different counties, and they were either the supervising or the lead health educator in those counties. And how do they plan on using it? Using it to support curriculum development in health education classes, using the toolkits in health education classes by the teachers, and then using the training Kahoot quiz. There's a quiz there that they have that they're going to use the quiz to engage students in tobacco cessation discussions. So we are doing both cessation and prevention support in the center. We also, access to nicotine replacement. You can get that through the quit line. You can sometimes get it, and you certainly can get it over the counter. But to get it paid for by Medicaid, it needs to be prescribed. And so We set up a pharmacy work group to kind of check on how we could do this. We have had a number of groups here. We are looking at smoker access to tobacco cessation aids in pharmacies. And under consideration this year, there is a bill that would enable pharmacists to prescribe NRT so that they could get that reimbursed by Medicaid. And we are bringing together partners from around the state, from the School of Pharmacy, the Legal Resource Center, ours, the Tobacco Prevention and Control Center at MDH, as well as other interested people and students who are in some of these programs. So we're going to keep working on that and kind of looking at that and seeing having a next work group meeting sometime in February. So I just wanted to kind of give you kind of an overview. That's a quick overview. If you have questions, would you just put those in the chat if you have questions for me about what we're doing, about where we are? And I'd be glad to answer you. If you have questions about tobacco control in the state of Maryland, we'll do our best to answer them. You can contact us at info@marylandtcrc.org. And I'll give you a minute of any questions or comments or thoughts from the group.
Yep, so I could read those for you, Carlo. Sure. So we did have someone say thank you for offering the Stanford University Tobacco Prevention Toolkit training and stated that it was really helpful. And then we also have a question about if there's any cost for the tobacco trainings.
If there's any what?
Cost for the tobacco training.
Yeah, no, there's no cost. This is totally free. The materials, I mean, obviously we're supported by the state tobacco control folks, and the materials, the manuals, I mean, we have a whole group manual that has lots of materials in there. So, you know, we were thinking about this, you know, as a kind of immediately you could go and do a group the next day if you wanted to, because you had all the materials there. So we've created that over the years with support from the MDH as well as from some grants. And so we have all of that, and it's all free for you and for your providers. Anything else?
Great. So we had a question in the chat if we will have the training from February 2021 be offered again, and I'm trying to see which training that was.
That's got to be the training. We are working to try and bring back a training for the Stanford Toolkit.